Whoever's going to do that. Good morning and welcome to Falls Free Friday. Thank you so much for joining us on this slightly cloudy Friday, September 15th. My name is Elizabeth Head. I'm the Deputy Director for Injury Prevention at the Georgia Department of Public Health. We are so excited to bring to you another Falls Free Friday presentation this morning. A couple of notes of housekeeping. This session is recorded and will be posted on the Injury Prevention Research Center at Emory's YouTube channel and their website so that you can access it later. We're very excited to be able to do that for folks. In addition, this entire series is brought to you by the Falls Prevention Task Force. It is co-facilitated by Department of Public Health and our friends at the Injury Prevention Research Center. It is staffed by incredible partners across the entire state of Georgia from all sectors, including friends at Shepherd Center, friends in Gainesville at Brenau University, friends at Mercer University, and other partners throughout the state. And we're very grateful for their leadership, their subject matter expertise, and just their contributions to everything we do throughout the year. So with that, I'm going to do a quick introduction of our speakers, and we will dive right into our fabulous content for today. We have two speakers. The first is Kathy Cameron. She has more than 25 years of experience in the healthcare field as a pharmacist, research, and program director. Her focus has been on falls prevention, geriatric pharmacotherapy, mental health, long-term services and supports, and caregiving. Cameron is a senior director of the National Council on Aging's Center for Healthy Aging, where she provides subject matter expertise on healthcare, programmatic, and policy-related issues. And she also oversees the Modernizing Senior Center Resource Center. We're very pleased to have Kathy join us. In addition, today we have Emily Neighbors. Emily is the program manager of the Fall Prevention Center of Excellence at the University of Southern California, Leonard Davis School of Gerontology. Her work aims to educate service providers and professionals on fall prevention and home modification to promote community living. She is the director of the Executive Certificate in Home Modification Program, instructs a course about building home modification coalitions and increasing community awareness. She's been at the center since 2008 and develops resources for professionals and consumers, conducts applied research, provides technical assistance, and co-facilitates the National Home Safety and Home Modification Work Group. We're so pleased to have you both join us. I will turn it over to you now, Ms. Kathy.
Okay, hopefully you can all see my slides, and good morning, everyone. Emily and I are really excited to be here with you this morning as part of the Georgia Falls Free Fridays during Falls Prevention Awareness Month. The focus of our presentation is on preventing falls with home safety. So we're going to talk about some of the things that you can do either by yourself to make your home safer and reduce your risk of falls, or things you might do in partnership with others in your community. So maybe more extensive home modifications, for example. And before we dive in, we just wanted to share a little bit about both of our organizations. As Elizabeth said, I'm with the National Council on Aging. We're a 70-year-old national nonprofit organization based right outside of Washington, D.C. And our vision is a just and caring society in which each of us, as we age, lives with dignity, purpose, and security. And we have two focus areas at NCOA, healthy aging and financial security. And we do a lot of work on the financial security side on linking older adults and persons with disabilities to benefits at the federal, state, and local level. And we have a social impact goal of 40 million older adults impacting their lives by 2030. And the work that we do focuses on developing resources for professionals as well as older adults, caregivers, and others. We develop lots of tools, including our Benefits Checkup, which is a free service, benefitscheckup.org, where people can go in and find out what benefits they're eligible for. We develop lots of best practices for the field of aging and public health and healthcare, and falls prevention is one of our focus areas. And then we also are very active in advocacy. in Washington, D.C. to support, improve programs that older adults depend upon, like the Older Americans Act, Medicare, and Medicaid. And I run the National Falls Prevention Resource Center. We are federally funded by the Administration for Community Living. I have the link here to our resource center. We increase public awareness about falls prevention, and today is certainly one of the activities that we like to do, is to share what we know about falls risk factors and things that older adults can do to prevent falls. We serve as a clearinghouse for tools and resources around falls prevention. And a large part of what we do is working with local organizations to support their implementation of evidence-based falls prevention programs and strategies. And we've worked closely, for example, with the Atlanta Regional Commission. They have a grant from ACL to implement some evidence-based programs. We lead the National Falls Free Initiative that includes federal partners like the CDC and the Administration for Community Living, as well as many national professional and consumer organizations. We do a lot of support for state falls prevention coalitions, including the Georgia Coalition, in which the Georgia Department of Public Health leads. And we've also developed a national action plan. It was updated in 2015, and we're planning to update it again next year as part of a national summit that we are going to be hosting. And then we're really excited because next week is the annual Falls Prevention Awareness Week. It's always held during the week in which the first day of fall occurs. So that is next week. And the purpose is to increase public awareness across the country about how to prevent falls and fall-related injuries among older adults. So we do a lot of education. We're doing a radio tour. We try to get people to take real action, and we do advocacy as well. There's going to be a Hill event next week with one of our U.S. representatives who has become a real falls prevention champion. So that'll be next Wednesday. And so that is kind of a highlight for us for our year at NCOA for falls prevention. I guess I think this whole series that Georgia is doing is part of trying to also increase awareness and educate the field and older adults about falls prevention. So I'll turn it over to Emily to share a little bit about where she is based.
Thank you, Kathy. I work at the Fall Prevention Center of Excellence, and we are based at the University of Southern California Leonard Davis School of Gerontology. It is the oldest and largest school of its kind. At the Gerontology School, we conduct applied research in fall prevention, home modification, universal design, and aging in place. Our faculty has been working in this area for over 3 decades, faculty and staff. At the Fall Prevention Center, in addition to this research, we develop and disseminate tools and resources for professionals and individuals and their caregivers. And we disseminate this information on our website, homemods.org. We also offer an online professional training program, the Executive Certificate in Home Modification Program, for professionals in the aging, disability, housing, and healthcare sectors. Next slide. I'll be reviewing and highlighting a few more of our resources towards the end of the presentation, but I wanted to highlight our consumer awareness section of our website, and it has information that's presented according to population. So we highlight information for veterans, tribal older adults, people living with disabilities, caregivers, and LGBTQ plus older adults and community members. Next slide. Okay, I'll pass it back to Kathy.
Thanks, Emily. So this is the why. Why are we here today? Why do we care about this problem? And I think you're here because you probably understand this already. So I won't spend a lot of time, but we know that every year 1 in 4 adults over the age of 65 will experience a fall. About 20% of those falls will result in some type of injury, like a hip fracture, like a brain injury, a subdural hematoma, for example, broken bones. And we know that the rates of falls are increasing among the older adult population, and that the reasons are many. Increasing rates of chronic illness that are related to falls risks, use of medications, for example. So we are, there's a lot that we need to do to educate, increase awareness, and try to reduce these rates from happening. We also know we spend a lot of money on the consequences of falls, about $50 billion annually. 70% of those costs are paid for by Medicare and Medicaid. But I really think, the reason I do this is the impact that falls have on the lives of older adults, on their quality of life. We know that many adults develop a fear of falling that can really impact their daily activities. It can lead to things like depression, social isolation. It's kind of a vicious circle. When you don't engage in regular activities because of that fear of falling, you're going to continue to increase your risk because of the lack of perhaps physical activity, for example, loss of function. So, so we talk about all of these different things that impact older adults, and we want to change these negative impacts. We want to prevent as many falls as possible. And we know that it takes partners to make this happen. Everyone can play a role in preventing falls, and we work with multiple stakeholders across the country, and public health certainly plays a really important role in preventing falls, but also we need to get clinicians involved more, primary care, OTs, PTs, etc. And certainly the Aging Network has a really important role to play in implementing evidence-based falls prevention programs and serving a role. So these are the risk factors. Research has shown that there are multiple risk factors for falls, and you can characterize them as kind of a tower of blocks, where each block represents one of the risk factors, whether it's sensory deficits, for example, like vision and hearing impairment that we know lead to an increased risk for falls, low blood pressure, which could be caused by the use of medications. Maybe the medications are inappropriate for the older person, or they might be might be at the wrong dose, and that's causing some problems. They could have mobility issues, balance problems. And the more risk factors that a person has, the greater risk that they're going to experience a fall. Research has shown that. So this slide kind of lists what the research has shown are the primary risk factors for falls among the older adult population. Today, we're going to focus on the home and environmental hazards that pose risk for falls. This is a tool that we have on our website that we share quite a bit, addresses multiple risk factors. Find a good balance and exercise program. There are many that are available, I think, throughout the state of Georgia that are offered in senior centers through AAAs, etc. Talk to your healthcare provider, have a conversation about maybe that fear of falling that you might be experiencing. Regularly review your medications. We won't spend a lot of time here, but there are certainly classes of medications that increase the risk for falling, as well as the sheer number of medications that older adults take. Get vision and hearing checked regularly. Keep your home safe. That's what we're going to talk about today. And talk with your family members about how they can help you reduce that risk. And a big part of that is maybe making changes in the home to reduce those hazards, for example, or make some modifications to make your home safer. So what do we know about falls in the home? About 60% of all falls happen in the home among those over the age of 65. A lot of older adults think, well, falls happen outside the home. Actually, that's not the case. So staying at home, you're still going to experience a fall. The most common places where we see falls are on the stairs, bathroom, slippery surfaces, hard surfaces. We see a lot of injuries in the bathroom because of those surfaces. The bedroom, oftentimes it's that pathway from the bedroom to the bathroom that many older adults have to take during the nighttime to use the bathroom. And we'll talk about the importance of lighting. And certainly in the living room could be, clutter in the living room, rugs, maybe placement of furniture, for example, isn't optimal, etc. And so here listed are typical environmental hazards in the home, like cords, unsecured rugs and carpets, clutter, those slippery surfaces that I mentioned, lighting, and we'll go into more detail about some of these things during our presentation. So I'm going to turn it over to Emily to talk a little bit more in detail about home safety.
Great, thank you, Kathy. Well, many of you have probably seen the statistics that the older adult population is growing rapidly. And the majority of older adults want to stay in their home and community as they age. And this is great. There are many benefits to that. We refer to it as aging in place, and that can help people stay connected to their established relationships, to resources that they're already using in the community, and it can help support independence. While more people are aging in the community, this also means more people are living with disabilities in the community. 28% of households that have a person age 65 and older have at least one person living in that household who has difficulty using some element of the home, such as climbing stairs or using the bathtub. Next slide. So it's optimal for people who are able to remain in the community as they age to do so. However, most of the US housing stock was not built to support aging and to support people who are living with disabilities. Less than 4% of residential units in the US are suitable for people with moderate mobility disabilities. And about 1% are wheelchair accessible, fully wheelchair accessible. So as people age, their homes are aging as well, presenting barriers to independence and hazards that can lead to falls. Having a safe and supportive home environment is really integral also to the delivery of home and community-based services. These services are helping people to stay in their community longer and avoid moving to a facility where there's a higher level of care. But having that safe and supportive home environment is really critical to safe and effective home and community-based service delivery, having caregivers in the home, and also supporting the individual. They may be having home delivered meals and they have transportation to help them stay independent. But if their home environment is unsafe or not as supportive as it could be, that could be what leads to needing a higher level of care or support in order to stay independent. Next slide. So what is home modification exactly? It's changing the environment and one's behavior to increase safety and support. We talk about removing hazards, adding supports, and then changing behavior. Home modifications have a number of benefits that research has shown. They can make daily activities easier for people, and that supports independence, reduce falls and injuries. Both of these can help people avoid moving to institutional settings. Home modifications have been found to be cost-effective as part of certain programs, looking at dollars for Medicare enrollees. Home modifications can increase social connectedness and activities. One study looked at people who had home modifications that made it easier for them to bathe and get ready to go out and be social. And when they were able to do these activities with less burden and in a shorter amount of time, they were more likely to go out and be with others and be in the community. Home modifications have also been shown to support caregivers. Caregivers are helping people in their homes with their daily activities. And so any supports that help with daily activities help caregivers as well and reduce their risk of injury. And home modifications as part of an evidence-based program that we'll be looking at or mentioning soon, the CAPABLE program. It was found to reduce depression among people who participants in that program. Next slide. There are many different types of home modifications. I know some of you may, think of ramps immediately or grab bars, but there's actually quite a range. We look at major home modifications, which can often include changing the structure of the home, doing a big bathroom remodel. There are minor home modifications, such as installing a grab bar. Home repairs are often part of the modification process. Sometimes repairs need to be made before modifications can take place, such as plumbing repairs in the bathroom, for example. Assistive technology is also part of home modification and can play a key role in helping people stay independent and supporting those daily activities. There are state assistive technology programs that can be excellent resources related to home modification and technology and equipment. And then there's also durable medical equipment. There's a lot of overlap here. An example is like a shower chair or bench. So there's many different types of home modifications. Next slide. Home modification is also a process. It goes beyond just installing the grab bar. When we're looking at a program or an agency that delivers home modification services, there's usually an intake process to make sure an individual is eligible for the services. Then there's an assessment, ideally of the individual and how they interact with their home environment. Many assessments have been designed to be conducted by occupational therapists, and they have expertise in identifying areas where an individual's home environment could be more supportive as they conduct their daily activities. So they can identify hazards and areas that need support, and then they can also make recommendations for home modifications that are appropriate short-term, but also considering long-term, someone's long-term needs, which is especially important when people have chronic conditions or a progressive disease where their needs may change over time. Then we might find many issues in the assessment that could be improved, but sometimes we need to set priorities either related to cost or the most urgent need. Then securing funding. Funding is not necessarily always available, so that might be part of the process. Then installing the home modifications. Sometimes a contractor or handy person might need to be identified to do that. Then follow-up is last but not least an important part of this process, to make sure that the person receiving the home modifications understand how to use them, that the home mods are addressing their needs, and just making sure that nothing needs adjustments and they are satisfied. Next slide. So we wanted to share some examples of home modification to bring this to life a little bit. These examples are in the bathroom. In the top left, there's an example of storage that's easy to reach, so people don't have to reach up high or bend down low and risk losing balance. In the bottom left, we see examples of grab bars by the toilet and by the sink area. I think both toilets on this slide are comfort height, so a little bit taller, and that makes it easier to sit down and get up when toileting. In the middle, we see a change in flooring with no threshold and some embedded night lights to make that path from the bedroom to the bathroom safer, like Kathy had mentioned. And on the right, we have a roll-in shower. It has grab bars and an adjustable handheld shower head that can also help with bathing when someone's not able to move their body around in the water stream. It's easier to move the water stream using that handheld shower head, and the controls are in an easy to reach place as well. Next slide. Here are a few more examples in the bathroom. On the left, an example of lighting in the bathroom underneath cabinetry. And in the middle, another roll-in shower with textured tile that reduces the possibility of slips, and more grab bars and adjustable handheld shower head. This is also a great example for people to help people understand that not all home modifications look institutional. That can be a barrier to receptivity to home mods. And there are a lot of great products and designs that can fit into a residential home. And then another example of a grab bar and support by the sink. Next slide. I think this is our last set of photo examples. These are around the kitchen. One includes pull-out shelving. There's also a spot to sit down when preparing food in the kitchen, and this seating can be put away when it's not in use. And on the right, there's a set of stairs. We're kind of looking down on those stairs, and there are anti-skid strips to reduce the risk of slips. Next slide. And research is growing, evidence is growing to support the effectiveness of home modifications. We're highlighting an article here where researchers conducted a literature review looking at 7 different fall risk factors, and then 7 evidence-based falls interventions. And home assessment and home modification recommendations by an occupational therapist were found to prevent the most falls and save the most in direct medical costs in this research study. So that was really exciting to have the research further support home modification. Next slide. We'll pass it back to Kathy.
Great. Thank you, Emily. I just wanted to share with you kind of a list of evidence-based falls prevention programs that have been shown to reduce falls risks, and/or injuries among older adults. And these are programs that we help to promote at the National Council on Aging, and we work with community providers to get these programs up and running and sustained. The programs on this list that are highlighted in kind of the bluish green color are those that have a home modification or home safety component built into them. The 2 that are listed at the top, though, are focused exclusively on home safety, home modifications, as well as other things. So the first one is Capable, that Emily referenced a few minutes ago. And Capable stands for Community Aging in Place, Advancing Better Living for Elders. And it is a program that is offered kind of one-on-one, or actually it's a team-based approach that includes an occupational therapist that research has shown has been effective in reducing falls. An occupational therapist, a nurse, as well as a handy person who goes into the home and really does a thorough assessment of the individual situation, works with the individual. It's very consumer driven program, consumer directed, where the individual really talks about what their goals are for improving their home environment so that they can live as full a life as possible. So, and they may address other things too, like medications, but the handyman is used to come into the home to make those home modifications, some of which, Emily talked about here, but it could also be, putting a ramp in the home or a ramp at the entrance. It could be fixing the entrance because the steps have deteriorated over time and have become very wobbly and unsafe. So it could be a range of different things. So it's a really excellent program, well researched, and it's been shown to, within the Medicare program, save significant dollars in reducing hospitalization, emergency department visits, and other healthcare costs. The next program is a home hazards reduction program. That is also an occupational therapist-led program to do a home assessment and help older adults reduce those hazards in the home. The other programs like A Matter of Balance, Bingo Size, the CDC's Stopping Elderly Accidents, Deaths, and Injuries program, Fallscape, Stay Active and Independent for Life, or SAIL, or Stepping On. They all include either one session on home safety and home modifications or the environment, or it's touched upon within a session. So just wanted to point out these, and I know in the state of Virginia, some of these programs are actually up and running. Certainly Matter of Balance, Bingo Size, hopefully Steady is being used by healthcare providers in some parts of the state. And so for those of you older adults here who are looking for a type of program, contact like your senior center or your local agency on aging to find out what evidence-based falls prevention programs are being offered. And so I will go to the next slide. So we want to spend the rest of our time with you before Q&A to kind of go through, some practical tips. What are things that older adults can do themselves? They may need someone to come in and do a home assessment, and there are or they can do a home assessment themselves. There are consumer-related home assessments that Emily's website has information on that we'll get to later on in the presentation. But we thought it would be important to talk about just generally, how do we make our homes safer? And this is a resource that we have on the National Council on Aging's website. I've got the link here on the slide. These are sort of 5 quick and easy home modifications to make your home safe. First is secure some support. So if you are having difficulty using a shower, buying a shower seat, getting a shower seat installed in your shower would be great. Finding someone who has the know-how to appropriately install grab bars. And Emily provided some excellent examples of those. If there's difficulty getting on and off the toilet, getting into the bathtub, maybe installing an adjustable handheld shower to make the shower process easier. And it could be both for the individual as well as for the caregiver. Light it up. Replace burnt out bulbs with bright non-glare light bulbs. For many older adults, they cannot do this by themselves. So seeking help from family members, friends, neighbors, etc., to make that happen is really important. But making sure lighting is working throughout the home, outside the home is really important. Having a seat, placing a sturdy chair in the bedroom. So for many older adults who are frail, having that seat in the bedroom is really helpful while getting dressed. Clearing the way, keeping items off stairs, removing clutter throughout the house, removing throw rugs. I know there's a lot of resistance for some older adults to remove the throw rugs or the carpets that might be on the floors if they're if they do not want to remove them, make sure they are tacked down really, really well, and that there isn't edges that people can trip over. And then store for success. I think Emily provided a really nice example of keeping things that you use regularly close by, between the waist and shoulder height. So the example Emily provided was in the bathroom, but we can also do that in the kitchen, having those items that are used frequently out on the kitchen counter so that you don't have to use stools or chairs and things to get to those items or get on your tiptoes. So those are some sort of very basic things to think about to make homes safer. And we, Emily and I and others worked on developing a more detailed sort of practical tip tool that we also have on NCOA.org's website. And I'll have Emily talk a little bit about some of the other things that we haven't yet talked about in terms of these simple things that can be done. Not, I should say, maybe not all simple. They may have costs associated with them. And we'll talk a little bit later about who older adults or aging service providers can partner with to make this happen and where some funding sources are available.
Great, thank you, Kathy. Yes, we spent quite a bit of time developing this assessment tool that puts together many practical tips in one place. We also identified with these little icons, kind of the health plus sign and a little hammer we added them to indicate when it might be helpful to have either a health professional or housing professional assist with some of these tips. So we've gone over a few of the items here on this slide that are meant to increase safety and independence. These are in the bathroom. One that we haven't discussed is setting the hot water heater to 120 degrees Fahrenheit or lower. This can save money, and it can also prevent scalding and burns. So something easy to do to increase safety. Next slide. So many of these tips relate to the kitchen, and these reduce the need to reach up high or bend down low and risk losing balance. And again, another kind of aging in place tip is to replace knob style door and faucet handles with lever style handles. This can support aging in place, help people who have arthritis to open doors and use the sink. Next slide. So some of these tips apply to the living room and reducing trip hazards, really removing clutter from the floor. You can increase storage for these items. Even our beloved pets can be risks for falls, the pets themselves getting underfoot, or their toys, food bowls, etc. So it's important to try to keep those items out of walkways. Securing cords to walls or floors, and like Kathy said, replacing light bulbs and trying to use light bulbs that would not cause glare, because many older people have either age-related vision changes or vision impairment, and glare can be an issue. Next slide. And these are a few more. Many of them are small, low-cost changes that can have a big impact. It can be really helpful to either place telephones in an easy-to-access place or keep your cell phone handy. This is in the case of a fall. It's really important to be able to get help if you need it, to reduce the amount of time that you or a loved one spends on the ground after they've fallen. There are other kind of tips for convenience, using a rolling cart to move items around the home rather than carrying them. It's ideal to have handrails on both sides of the stairs to support people who may favor one side if they've had a stroke, for example, or if you're just carrying something up the stairs with one hand, you can use the other hand on the handrail. And having light switches at the top and bottom of stairwells can eliminate the need to be going up and down stairs in the dark. Yeah, and even having a table for packages by the door and a chair to sit down when needed. These are kind of smaller changes, but they can make a big difference in terms of reducing the risk of falls just during daily activities. Next slide. And we created these instructions or guidelines for this home assessment because there are a lot of recommendations. They may not apply to every person. So you can look through, identify which changes might be a priority for you, determine if you need a professional's assistance to make these changes, and make sure that you're happy with them, seek help to make adjustments if needed, and then over time, do the assessment again. People's needs change over time. As I mentioned, our homes age with us, so situations change, and it's important to kind of consider this as an ongoing process. Next slide. And so Kathy mentioned earlier on the importance of partnerships in falls prevention and home modification. And so we wanted to share some examples of potential partners for professionals and providers to expand access to home modification services. These are also potential professionals that individuals and caregivers could reach out to for help with home modification and accessing services. We've divided these partners up into categories of housing, healthcare, aging, and disability. We also have a box for voluntary groups and nonprofits, such as Rebuilding Together and Habitat for Humanity. We're aware that Habitat for Humanity was kind of born in Georgia, and both Habitat and Rebuilding Together have really expanded and strengthened their focus on aging in place. So that's really exciting to see the activity that's going on in different communities across the country. Also, Meals on Wheels, they have an initiative focused on older adult home safety. Many Meals on Wheels chapters are involved, and churches and religious organizations and Rotary clubs, other local groups can also be a source of partnership and support. Next slide.
Great. And I'll add to
yes,
that
please.
too. I think many of these organizations or individual healthcare providers can also help perhaps identify funding sources to do some of these home modifications, particularly if the home modifications are more extensive, like installing a ramp in the entrance of a home so that an older adult can safely enter and exit the home. So there are a range of funding sources through aging services. Some area agencies on aging use Older Americans Act for this. Perhaps some local health departments have some funding available, and certainly groups like Habitat for Humanity, Rebuilding Together, they have funding and use volunteers to make these modifications happen in the home. But there are other sources of funding too, and that's an area too that Emily and I were trying to kind of get the word out about how do we leverage these funding sources across the country. There's sort of a disparate range of sources, and it's hard to navigate at times. But certainly there are resources available, particularly for low-income older adults. And I think even some Medicaid programs, like Medicaid waiver programs, can be used for those low-income older adults, persons with disabilities, to support aging in place by the use of home modifications.
Great point, Kathy. Thank you. Yes, and actually in Georgia, there is a Medicaid waiver, the independent care waiver that supports community living for adults with physical disabilities. I'll highlight a tool that we developed where you can identify more funding sources. This first one is a home modification toolkit that we developed with funding from the Administration for Community Living. And this is available on homemods.org. It is primarily for professionals and providers, although there are consumer fact sheets and videos in this toolkit as well. But it offers partnership ideas and strategies that are taking place primarily in the aging network across the country, funding sources, home and person assessments. And yeah, we recommend that you check it out. There are a wealth of resources within this part of our website. Next slide. Also, with funding from ACL, we developed the Home Modification Information Network. And this is a compilation or inventory of home modification programs, providers, and funding sources. It's searchable by state. And we are really excited about this because it aims to bring this information to your fingertips. As Kathy mentioned, identifying home modification funding can be really challenging and complex because there's funding from many different sectors: housing, aging, disability, and healthcare, insurance, taxes. And then there are also eligibility requirements related to each one of those. So we encourage you to check out the Georgia page of our Home Modification Information Network. There's also, through the Georgia Department of Community Affairs, the Home Access Program for people with disabilities to prevent going to a nursing home. There are grants for accessibility improvements through that. There's a home purchase or retrofit credit as well through the Georgia Department of Revenue. So yeah, this information is available on this part of our website. Next slide. Oh, okay. I will pass it to Kathy.
Yeah, so we've included some links here for some of the resources that we've been talking about this morning. On the NCOA website, we kind of separate out resources on falls prevention for older adults and caregivers. So you can take a look at what we have there, including the practical tips tool that we went through a few minutes ago. And then we have lots of resources for professionals, including our Falls Prevention Awareness Week toolkit that many professionals use as they plan for activities for Falls Prevention Awareness Week. We also have descriptions of all the evidence-based falls prevention programs that I briefly touched upon earlier, and many, many other resources and tools. So take a look. And then the homemods.org website has many of the things Emily just spoke about related to the information network, Home Mod Toolkit, the Excellent Certificate Program, consumer awareness resources, and then really very detailed resources on home assessments or assessment tools that older adults and caregivers can use themselves to assess their home, as well as those that are used by professionals. And then we talked about the funding sources and resources available for people to look for funding to support home modifications. So that's our content for today, but I know we probably have a few questions. And really, thank you so much for joining this webinar. And we will, discuss, answer any questions that we didn't get to. So I'm going to stop sharing so we can all see each other.
Thank you so much, Kathy and Emily. A really fantastic wealth of information available. We've had our colleague Megan Pathano putting some links in the chat in the background.
Oh, great.
I did get one question from somebody, and they were asking about the home modifications and the benefit to a younger population of adults, so maybe they could age with those as opposed to trying to introduce them to a 65 years and older group. And I was curious your thoughts on that.
Sure, I'm happy to go first, and Kathy, feel free
Yeah,
to
go
chime in as
ahead.
well.
Yeah, lots of thoughts.
Yeah, yes. Yeah, that is an excellent question. And in addition to home modifications, there are other initiatives and opportunities and approaches. One is called universal design, and it includes features and products that support people of all ages and all abilities. So an example could be a curb cut in the built environment that would help someone who uses a wheelchair or a walker with wheels. It would also support someone who's going to work or traveling with a rolling suitcase, and a parent pushing a stroller. So there are some features and products that ideally they would all be baked into housing when it's first built, so we don't have to go back in and make these modifications. However, home modifications are typically tailored for the individual who lives in the home, so that certainly has its own benefits. Yes, and it would also be ideal to have home modifications in the home as we age for the young old population or younger adults, to plan ahead and support their aging in place process, reduce the risk of injuries. Anyone can benefit from having a grab bar in a shower. If you were to slip, it can help with safety and independence. Kathy, did you have anything to add? Or
Yeah, just a couple of thoughts on that. I agree. I think so many older adults have to make modifications to their home when they have a crisis. They've, unfortunately had maybe a hip fracture, they're being discharged home and they can't even get into their home, or they don't have, a bedroom on the main level, and they'll have to climb stairs, but they're not able to. And we're trying to educate people about the importance of planning ahead, how critical that is, because as Emily talked about, most people want to age in place. And one thing that the data shows is that so many people, like in their late 40s, 50s, that's the age group in which a lot of home remodeling is happening. And to get them to think about how they use that home remodeling experience to think, 10, 15, 20 years out as to how they can make those non-institutional looking modifications to their home. And Emily showed examples of those so that they can stay in their home and then they won't have to deal with that crisis situation. So yeah, we have partners who are, trying to do a lot in that space. And, some states are offering like tax credits for people who make modifications to their home to make them more livable. And hopefully more states will pick up on that, or maybe we'll have some, federal tax policy to incentivize people to make those changes earlier on. So that's really vitally important. Yeah, as our population continues to age.
I'd never heard of tax credits for making smart safety changes to your home. That's absolutely incredible. Thank you for that. Other questions that anyone has for our experts?
Would you have any recommendations for like people who are traveling to, like if you are an older person traveling for the holidays to somebody's home, any recommendations for things that you could ask like your kids or something to do to make your event falls?
Well, as Kathy mentioned, we actually worked closely with NCOA to develop this inventory of home checklists and assessments. And there are some very user-friendly checklists that can guide you through the different rooms of your home and identify potential hazards that maybe as a younger person, it would not be on your radar. But when you're putting on thinking through the mindset of having an older family member or family members or friends with different abilities come to visit, it can help to identify areas and provide recommendations to make them safer and more supportive. That's one thing off the top of my mind. Kathy?
Yeah, I think another one that's not on kind of that checklist is portable ramps. So, many homes have steps to get into the home, or there are different levels within the home, and that can be really challenging for many people. But there are now expensive portable ramps that can be purchased for that purpose. Even like, thresholds, there are smaller ramps that you can put over thresholds, say to, go out onto a balcony, for example, or, get into the bathroom or into a shower. So just thinking about those simple things too. Yeah.
I love that. We're thinking of assistive technology as a whole, and you think technology and you think computers and Zoom and all those things, and it's not. They're really practical things that don't have to involve technology specifically.
Mhm. Absolutely.
And I just put in the chat a link to a collection of state tax credits for accessibility and home modifications that we developed. That's on our website.
That's fantastic. Thank you.
Yeah. And that might be something, if there are any advocates on the call, something to talk to elected officials in the state to kind of think about and use these examples of other states in your advocacy efforts.
Other questions for our speakers? Okay, well, ladies, thank you so much for your time today. Thank you to everyone who has joined us for our Falls Free Friday event. We actually have another Falls Free Friday event geared towards professionals scheduled for 1 p.m. today. And we will continue with our normal 10 o'clock offerings next Friday as well. Thanks to everyone for joining. Have a safe and happy Friday.